When you have a medical problem, you're hurting and you want care fast.
So, should you go to the ER or to urgent care? CBS 2's Dr. Max Gomez is here with some important ways you can tell. Doctor.
That's right, Maurice. Christine. For some problems, it's obvious you should be going to the emergency room. Heart attack, stroke, major trauma. But many people use the ER as a doctor's office for flu, cuts, or sprains. That just clogs up the ER, and you're going to be waiting for a while. The first rule of thumb is that if you feel the need to call an ambulance, you probably need to go to the emergency department. In fact, EMS will always take you to the ER. Even if you don't call an ambulance, though, certain problems are definite emergencies.
If you can't walk, if you're bleeding profusely, if you've passed out, those are the type of problems that direct you to an emergency department. Heart attacks, stroke, life-threatening injuries and trauma.
But there are many times when you feel sick or have an injury and the natural reaction is to want to be cared for right away. Like Teofilio Acosta, the Dominican native, had an ankle problem he might have gone to the ER for. Instead, he came to Cure Urgent Care on the Upper East Side. He tells me he came here because he knew he'd be cared for more quickly, and he's taking advantage of the visit to get a flu shot and a checkup. Plus, it's clear that Cure Urgent Care, like most of the 300-plus urgent care centers in New York City, are a far nicer and more inviting place than the typical ER, and they can take care of a pretty wide range of problems.
Upper respiratory illnesses like bronchitis and pneumonia. We see urinary tract infections, broken bones, lacerations, ear infections. We take care of digestive problems. We do procedures like abscess drainage.
And if your problem does require a transfer to the ER,
I'm going to be able to call ahead, make sure that you're not waiting, speak with the doctor and advocate for you.
Now, most urgent care centers take health insurance, and even if there is a deductible, urgent care visits are so much less expensive than an ER, but it's still much cheaper. But the bottom line is, if you're in doubt about ER versus urgent care, go to the hospital just in case.
Okay.
Okay.
Thank you, Doc.
Thank you, Dr. Max.